Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hello, I'm the weight loss champion, Chuck Carroll. Today we're going to be talking about the intersection of diet and sports performance. I'm so excited to be speaking with our guest today. He had his medical training, get this, took him from Harvard all the way to the Mayo Clinic. He then became the team physician for big-time Division I college athletics at the University of North Florida. Today he runs his own sports and lifestyle practice, and he offers healthy living retreats and plant-based seminars. Dr. Stephan Esser is here with us today. Dr. Esser, man, first of all, love your hair. Second of all, thanks for being here, man.
It is my pleasure to be here to share the message of health. So thanks for the invite to join you, and thanks for all the good work you guys do.
Thanks for all the good work that you are doing. A lot of times, at least recently on the show, we've been talking primarily about anti-aging and reversing chronic disease, but I want to talk about the athletic side of things. Obviously, the big boom with the Game Changers documentary a few years ago really put that spotlight on the connection between a plant-based diet and athletic performance. You have devoted your life to sports medicine. How many of these injuries that we see could be prevented if somebody were eating a better, healthier, less inflammatory diet, Dr. Esser?
Well, a huge amount of the injuries that we experience are related to a combination of mistakes that we're making in our nutrition, as well as perhaps in our training, our performance, et cetera. And the reality is many problems, like let's say tendonitis, tendinopathies, cartilage degeneration, chronic meniscal tears, are related to the levels of inflammation in the body. And so these smoldering sort of layers of inflammation are present so that the body doesn't heal well. So let's say, for example, you get a small little tiny rotator cuff tear after you played too much tennis, too many serves, and now you're having some shoulder pain. Well, instead of just masking the inflammation with some anti-inflammatories, if the individual ate a healthy program, more fruits, more vegetables, dilating blood vessels, improving blood flow, and activating some of their stem cells, as the studies now show, they're more likely to have a good healing event. You know, it's kind of crazy, but people, for example, who have elevated cholesterol have higher rates of rotator cuff tear and Achilles tendon tear, along with tendinopathies. So this kind of speaks to this powerful and very crucial overlap between the food we're eating and our risk of injury.
Does that help explain kind of the mystery of somebody who say it's a pro athlete and their career, they're just snake bitten by injury after injury after injury? You see these guys coming out of college with all this promise, but it just seems like season after season after season, it's another thing. It's another thing. It's another knee. It's another toe. It's another rotator cuff, whatever the case may be.
Well, there's no doubt that there's an intersection, right? That there's this effect because the food that we eat influences biomechanical load on our bodies. By the amount of weight we gain or lose, et cetera. The food we eat radically influences inflammation at the cellular level and the ability of the body to heal adequately. And the type of food we eat significantly influences perfusion or blood flow to an area. Doesn't matter how well you eat, right? If you don't open up those blood vessels and deliver the nutrients and the oxygen and carry away the lactic acid and the buildup of all these breakdown products, the myokines we call them, from exercise, well, the body can't do what it's meant to do. And so certainly eating the toxic standard American diet, right, is setting people up for failure. I mean, studies now show, it's crazy, that you have higher risk, for example, of knee osteoarthritis if you have high blood pressure. What? Well, it's because when you increase systemic blood pressure, you increase blood pressure in your bones. And when you increase blood pressure in your bones, it inhibits blood flow to the ends of the bones, which is where the cartilage is. So now as an independent risk factor for knee arthritis is your blood pressure. So really interesting data coming out. We're learning so much more year after year, but it all validates what we're preaching, that more micronutrient-dense plant-based foods is at the foundation of people's health.
All right. So that is fascinating to me. High blood pressure equates to problems with the bones. I don't think a lot of people put those things together. I think when people think high blood pressure, they think heart, which rightfully so, but it impacts the bones. That's really interesting. And then when you think about what the typical pro athlete eats, I mean, it's gotten a little bit cleaner over time, but I remember my days covering the NFL, going out to eat with some of these guys, and you would be amazed at not just the volume of food they were putting away, but the type of food they were putting away. I mean, we're talking about plates of wings that are like, I don't know, like taller than I can even extend my arms. It's just amazing, Doc.
Yeah, and what's tragic, right, is especially in sports like you're describing, the NFL, the amount of force and impact into the structures, the bones, the tendons, the ligaments, it's super physiologic and it's not ideal. And so the risk of injury is already very high. But now add to that a compromised system, and we're in a very unhealthy place. So Johns Hopkins researchers did fascinating studies where they fed people who had no blood pressure issues and were otherwise healthy. They fed them a high-fat, high-cholesterol meal. And for 4 hours after that meal, the ability of their blood vessels to dilate to stress was reduced by 50%. That's pretty huge. And what was fascinating, though, is they took those same volunteers and fed them spinach, blueberries, dark chocolate. And what happened? Their blood vessels dilated. In addition, they did additional studies where they fed them the high-fat, unhealthy meal, but also gave them some spinach and blueberries. And there was an ameliorating of the negative effect of the unhealthy food. So this reminds us, right, that what we are eating is truly information at the cellular level. And if you want your body to be able to perform at peak, and number two, to recover more rapidly, well, eating ththese micronutrient-dense, anthocyanopigment-rich, flavanol-rich foods dilates blood vessels, reduces inflammation, and helps you perform at your best. Whether your performance is just hiking up a flight of stairs, picking up some boxes in your garage, or being a professional athlete.
Yeah, that's a great point. There was somebody on my show. It was actually a friend of mine, Dr. Jim Loomis, who, like you, was a sports physician for a while. He was with the Rams and the Cardinals when the Rams were still in St. Louis, and he was like, everybody's an athlete, whether it's doing laundry and carrying it up and down the stairs, or just riding their bike around the neighborhood. We're talking about mundane things. You don't have to be a professional athlete to reap the benefits that you're talking about.
Well, that's right. And I think it's so crucial that we all remember this, because as we age, there's a tendency for people to put themselves, quote, on the shelf, right? My grandfather used to talk about that. Don't go on the shelf, men and women in your 50s and 60s, right? This idea that, well, I've had my athletic performance in high school and college, whatever, and now it's time for me to rest on the couch. And the problem just is, that's not our goal. We all want to be able to do more, play with grandkids, go for a hike, go to somewhere we've never been, clean the house, lift objects, plant in the garden, play the athletic sport, whatever it might be. And it's like, but that only comes, as Joseph Pilates said, physical fitness cannot be obtained by outright purchase nor wishful thinking. We've got to do the hard work. And that's the second big pillar, isn't it? Is we've got to stay moving and active along with filling up, right, with all of those micronutrient-rich, healthy foods. Crucial stuff.
All right, let's talk about somebody who's getting back in the gym. They're getting active. They don't want to be on the shelf any longer. They're dusting things off. Maybe they're trying to recapture their glory years in high school on the gridiron. I don't know, whatever the case may be. But you go, you work out, you get super sore for the first little while. Instead of reaching for that big bottle of Gatorade or some off-the-shelf commercial recovery fuel, what kind of recovery shake would you recommend somebody reach for?
Boy, you bring up a great point there, is because I have three perspectives with regards to recovery. Number one, especially if you're in the subtropical, tropical environment like I am in Florida, you want to recoup your water losses, right? So if you're getting out and you're wringing your shirt out and it's just dripping all over the floor, you want to make sure that you are hydrated. Number one. Number two, you want to reduce inflammation. When you exercise, you produce a lot of what are called myokines. Myo from muscle, cytokine means an inflammatory molecule. Combine the two, you've got a muscle-induced inflammatory molecule that is produced as a result of exercise, right? It's the debris of exercise, if you will. These circulate in the bloodstream after exercise. You want to squash them, absorb them, reduce them right away. And hydration will help your kidneys flush them out. Number two, you want to eat foods that absorb them. Studies show anthocyanopigment-rich foods absorb these inflammatory myokines and reduce inflammation, and they decrease delayed onset muscle soreness, which is that soreness after exercise we often experience 2-3 days later. So you should be having that big glass of water or two. Then you should be imbibing some berries, some greens, etc. This is where I go next, right? Reduce inflammation. That can be as just having that pint of fresh organic raspberries, right? And then chewing down some, fresh arugula or kale, or you can combine them into a nice smoothie and blend it up and drink it down. Number 3 is going to be replenishing your calories, right? So if you're eating a 100% plant-based program, right, you want to make sure that you're getting adequate total calories if you're really exercising hard and pushing the envelope a bit. So bringing those 3 together, hydrate, reduce inflammation, and then replenish the calories, helps your body have the fuel, have the hydration and the micronutrients to restore itself quickly and get you back out there so you can train again and continue to achieve those goals.
All right, well, let me ask you about this. Have you seen these marathons where it's like the beer marathon, where you finish the marathon and you're rewarded with, unlimited drinks of beer, or a pizza marathon where you run the race and then you get as much pizza as you could possibly want? What would the body's response be to eating those kinds of foods, seeing as though you're already going to be in what I would assume is a hyper state of inflammation, given the, pounding that you just put on your joints?
It is absolutely tragic, and it flies in the face of all science for them to do this. And it just breaks my heart, because I've even seen places like Mayo Clinic, et cetera, where they're holding and hosting, marathons, and people are drinking alcoholic beverages and toxic, garbage immediately afterwards. And it's absolutely toxic and tragic that people fail to follow the science. And that's why your voice being out there and sharing this message is so crucial, because yes, if you go from this hyperinflamed state of just having pushed the envelope and all of your systems are overloaded, and now you go out and have that pizza and beer and wings and chips, etc., your body is just doubly overloaded. And the perfect example of this was Jim Fixx, who's the father of American running, right? He wrote the textbook on running, literally. And he claimed he could run off anything he ate, right? And would famously eat, wings and burgers and fries. And yet at the age of 51 was found in his running shorts and on the side of the road with a massive heart attack, dead. And it reminds us, right, that you cannot trick the body, right? So when people talk about like my cheat days or things like that, it's like, no, you can't, number one. And number two, it reminds us that we're intended for specific fuel. And if you put diesel in your high test car and just rev the engine, it doesn't fix the problem, right? The diesel still is contaminating your fuel filters, rotting out your fuel seals, and causing major havoc, and eventually the decay and decline of your vehicle.
Ooh, you're a car guy. I like that. Let me ask you this then. What are some specific foods that you think people should be reaching for? I don't usually like to go reductionist on the show, but I can just imagine that there are a lot of exam roomies who are watching and listening right now. It's like, okay, well, I really want to focus on that reducing the inflammation aspect of it. So what are some big ones that you counsel your patients with?
Yeah, so you can break it down kind of into the anthocyanopigment-rich foods in the first place, because there were good studies, robust studies. Being a Harvard and Mayo guy, I like science. And so these studies demonstrate that consuming foods, we're talking raspberries, blueberries, blackberries, we're talking red beets, we're talking red cabbage, right? All this anthocyano means purple, red, blue sort of colors. So getting those red beans, the red onions, getting those in, these are absolutely crucial and essential. And then all of the deep green vegetables, remember, they are sources of natural nitrates. In your mouth, in your intestinal tract, and in your bloodstream. These nitrates are converted into nitric oxide, which of course is that crucial molecule that dilates your blood vessels and enhances blood flow. So you want to pack in the micronutrient dense foods and then dilate your blood vessels wide open so we can get all of this flooding through the system and immediately carrying away all of these myokines. So for me, I also love, for example, a good big glass of fresh squeezed carrot, turmeric, apple, lemon juice. That's a great go-to. Or a big fresh squeezed glass of all greens, green apple, cucumber, celery, and lettuce, right after a hard training session. And so if I'm out on the court or in the gym for a couple hours, I get home, that's the first thing, make a big squeezed glass of juice, maybe about 15, 20 ounces, and I'll just Now I got my water, plus I got all of these micronutrients. And then I'm reaching for the berries and more greens that I'm chewing. And then ideally a big salad. Remembering arugula, right, has some of the highest quantities of nitric oxide forming nitrates. So again, whatever I'm having, I may throw in a side salad of arugula, with some fresh lemon juice, a little avocado, and maybe some thinly sliced fennel, because fennel has a lot of ferulic acid, very anti-inflammatory, but it also activates stem cells and causes increased multiplication and differentiation. So getting some of these micronutrient dense foods in there, crucial for your recovery.
Sounds like you've been a pretty athletic guy your entire life. Have you always been into sports yourself?
Yes.
Yeah. So talk to us about maybe an experience where you may have, had a little bit of an injury and what the recovery process was like for you, especially eating the way that you do.
Yeah, I mean, I'd start with the simple is that just as a kid playing, so our sport is growing up as kids was tennis, so 3-4 hours a day of training, playing all the USTA and then national events and so on and so forth. I was number one in the US in men's open doubles back in 2002. But so we'd be out there hour after hour training, plus in the gym a couple hours, and my colleagues, my guys who were training with, they'd be fatigued, they'd be sore the next day. I'd be like, okay, let's go. Next day. All right, let's go. Next day. I'm able to recover so much faster with less pain and less inflammation. Now I'm entering into the place, right, where I'm almost 50, and it's kind of like, okay, well, I'm out there hitting with guys who are in their teenage years, and we're training for 2-3 hours, and I'm fine overall the next day. Not a big deal, right? But again, I've modified a little bit of my approach where previously it was just like, yeah, just eat a bunch of healthy food, move on. Now I'm focused in on those micronutrients to reduce that inflammation and get me back quicker. Things like, for example, on average, the majority of joint issues like the osteoarthritic changes, things of that nature, these areas get flared up if you eat unhealthfully, right? So if I go eat a bunch of salt or oil, et cetera, immediately I begin to go, oh, wow, now I know what people say, they feel their joints, right? But when I'm eating those micronutrient dense, super healthy foods, I don't experience, right, these common maladies that most people would experience. So it reminds us that inflammation is often at the heart of us experiencing pain and dysfunction in our joints. And that inflammation can come from 3 possible places. One is our belly fat, which produces adipokines, which are inflammatory molecules. 2 is the functional inflammation of just straight up activity, right? Like we said, the myokine production. 3 is going to be arachidonic acid. Remember, this is a precursor molecule that breaks down to form prostaglandins. Prostaglandins are the molecules that cause pain on average at the joint level. If you take an ibuprofen, you are blocking the conversion of arachidonic acid to prostaglandins. Well, guess where arachidonic acid is most commonly consumed? It's in animal-based foods and in dairy. And that's why vegans consume the least arachidonic acid. And it's part of why, on average, have less musculoskeletal pain. And then, of course, we've got autoimmune inflammation, its own separate topic. So again, when we're crushing these anti-inflammatory foods and we're not consuming the inflammatory ones, all of these common musculoskeletal issues are on average far less painful.
Man, it all comes back to inflammation, it sounds like, doesn't it? You're a funny guy. You're a humble guy. You snuck that in at the beginning of your answer. Yeah, I was the number 1 ranked doubles player in the USTA rankings back in the day. No big deal. Anyway, I'm going to give you the rest of my answer. And I was like, what, how, what? I mean, just way to blow right by that. I mean, that's big time stuff, Doc.
Well, this is about each and every one of us performing at our best levels, right? And so regardless of what each of us have done, what really matters is that future oriented, right? Because my goal with kind of sharing the message of health is that every single one of you who's watching this is able to achieve your best. Because isn't that the foundation of why we all want to be healthy? And that's where people, I think, forget sometimes that what we're talking about, what I'm always preaching is not, health is not the goal. Health is the foundational goal that unlocks the ability for you to achieve your best potential. And that's what's so exciting about it. Because if you can be healthy, now you can become the best version of you as the teacher, the father, the uncle, the cousin, the lawyer, the floor cleaner, the gardener, the whatever it might be. But without your health, you have none of that and none of that potential.
Amen to that.
Yeah.
Now, let's say somebody wants to tap into that potential, but they've been sitting on the couch. They got that big old beer belly that they've been working on for years. Would you recommend, do you think it's wise to tackle diet first before they step back out onto the tennis court or, try jogging or something like that? Really try to get that inflammation under control before they start working out again?
100%. In my ideal world, I'd tell people to do at least 2 to 4 weeks of excellent micronutrient dense living before you begin really putting pressure on the body and pushing hard. One of the saddest things I see are people who are carrying excess weight who then say, I'm going to lose this weight through exercise. And they just start pounding the pavement. And yes, they lose some weight, but by the time they've lost the weight they hoped to, their knees are completely destroyed now with a severe advanced arthritis. And that worries me, right? I'd much rather see them reduce inflammation inflammation, reduce some weight through nutrition. So for example, I have a 4-week and 6-week program and an 8-week program. And on average, men lose 20 to 40 pounds in 1 month on my simple 4-week program they can download and do at home. Women lose 15 to 25. And our 8-week program is live and combines both food, nutrition, and all these other fun things and exercise. But the reality is, right, we want people to make nutritional modifications, I think, prior to, or at least very early, dovetailed in with the exercise. And the exercise that should be done is stuff that doesn't just beat up your joints, but gets you moving and progressively stronger. And now we can begin to go for more impact, plyometric, et cetera.
And part of me wonders also if, because the body's already feeling better before it starts to exercise again, if person would be more inclined or apt to stay with this new way of living because they're not going to be so sore. They've given themselves a big head start before they start working out. So I think that you look at so many people are like the first of the year, I'm going to go to the gym, I'm going to work out. And it only lasts a week, 2 weeks, something like that before they tap out because they're in such pain. But if that pain isn't there, if that's not a problem, they're probably going to keep on going.
I love it. I agree.
Yeah. So let me ask you this. We haven't really gotten too much about your background other than your tennis accolades. You've been into this whole plant-based thing for a while now. How did you get started eating this way?
Yeah, so I'm a 4th-generation plant-based eater. So my great-grandfather, William Esser, was a tailor, made costumes in Pittsburgh, off the boat from Germany, and began to not feel very well and researched some of the classic traditional German guys who would help people, get better through food and exercise. One of them was Father Kneipp, a German priest who had a whole approach of using hydro treatments with cold water and hot water, and then a bunch of fruits and vegetables and teas, et cetera, and people would get well. So he started reading his writings and said, wow, I need to move out into the country, grow some plants, have some fruit trees, and raise my family there. And lo and behold, that's what he did. And as a result, my grandfather, Dr. William Esser, became a naturopath and chiropractor and started Esser's Ranch and ran this healthy living, fasting, and healthy eating facility on 10 acres of land in South Florida for 65 years. He ran it till he was 91, over 30,000 patients there. And so it was cool as a little boy running through the orchard, picking grumichamas and japoticabas and sapodillas and mangoes and sharing them with the patients and delivering water to people's rooms. I was blown away just to see, actually when I was a boy, I thought it was normal, everybody getting well. People, blood pressure coming down, their knee pain resolving, their diabetes going away. And I was like, how is this possible? This is cool, right? But I kind of took it for granted because when we were little kids, if you got sick, you just, ate really clean or fasted for a day or two and you were better. But when I went to med school, I learned that people didn't get well. We just gave them more drugs and more procedures. And it was fascinating to see this dichotomy. And so, yeah, I'm a 4th-generation plant-based eater, number one, because of how I was raised. Number two, most importantly to me, because of the science. Because the science as we know it today is so robust to the point that it's absolutely ridiculous for anybody to try to argue that eating more plants is unhealthy for you or not vitalizing for you. And so we're in such a beautiful place right now where the evidence is so kind of incontrovertible that for the common diseases, healthy micronutrient-dense plant-based diet is the way to go. And the science all says that. So we can feel confident in that. But yeah, it's been a lot of fun. Now my children are going to be 5th-generation plant-based. And it's a reminder to each of your viewers that the personal choices they make now may have nothing to do with their own personal life. It may be with the generations after them, which is pretty cool.
Absolutely. Clearly it got passed down and you're thriving there. I think back to your time in medical school. That must have been really jarring for you who, did you get into arguments with your professors? Did you raise your hand? You're like, well, wait a minute. That's just not right.
Oh, every single second of every day, right? Which was, I went in knowing that and expecting that, right? That there was going to be chaos and challenges and arguments and debates. And so it was crucial that I immediately looked at the science and literature so that I could have that backup, right? So when that cardiology professor was presenting and said nothing about Dean Ornish's programs that now had proven that there was this 80% reduction in the need for bypass in people who ate a healthy plant-based diet, I could raise my hand and go, Why are we not talking about the NEJM article published in 1995, blah, 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 by Dean Ornish, kind of a thing, showing this intervention? And what it turned into over time was the presenters all kind of knew this was going to come from me. And most of them would just be like, well, patients are unwilling to change. And that was the only response they could have, right? Which was at least great that we got to that point. The other thing I chose to do while I was there was to start a medical interest group. So I started a preventive medicine interest group that focused in on integrative modalities, on healthy living and nutrition. I invited speakers in. I'd make big batches of hummus and vegetables and all this, and I'd pay for it myself. And so we'd have, 30, 40 kids in there getting their free, pita bread meal with hummus and veggies, and listening to a doctor, some integrative medicine physician I may have found in the community, or a health speaker who would come in and present. So it was really cool because I also started a newsletter under the auspices of Student Affairs, and all of this to try to get the message of health to these very sort of, open minds at the time, knowing that by the time they'd get out, if I could have influenced them, I would have influenced hundreds of thousands of patients in the years ahead. So yeah, it was an adventure.
You've been a go-getter from day one. I love that about you. And let it not be said, I mean, great move bringing food to the party, man. Great move.
Yeah.
Let it not be said that health is not delicious, because it absolutely is. It absolutely is. Let me go back to your current practice here and ask you about kind of the intersection of, we've been talking much on the side of prevention through diet and stuff, but there is that marriage as well with diet and lifestyle changes, as well as like the current practices. I know that you still do traditional medicine as well, where you're doing injections and things of that nature. So if a person is really eating a healthy plant-based diet, does that make traditional treatments that much more effective?
Well, great question. It depends on what those traditional treatments are. There are the standard of care in orthopedic sports medicine, unfortunately, all too often falls back towards simple things like, let's say, steroid injections, which are relatively toxic to the cartilage, which are unhealthy for people's joints. So in my practice, I use those as little as possible, although I do use them. But I use a lot of cutting edge technology. You can see one of my ultrasounds here behind me with some images of a growth factor injection I just did for somebody's rotator cuff a couple minutes ago. And so what I do is I use the best of both worlds. I use the, quote, traditional approaches of diagnostic imaging and evaluations, right, at the highest level. And then we combine the knowledge. Once we have the appropriate diagnoses, we combine that with, and I give patients the options. We talk about all the different options that exist out there. Everything from the oral medications and supplements, the steroid injections, the gel injections, the biologics, the PRP, the stem cells derived from their own bone marrow or fat. And what I can tell you is really cool is the combination of these two, of nutrition with use of these biologics, is just outstanding. So I'll give you an example. A guy who comes in with moderate knee osteoarthritis and joint pain that's worse than going up and down stairs, squatting, pivoting, jogging, etc. He comes in, instead of me just saying, here's your steroid shot that'll make you feel better for 3 months, but it will wear your cartilage out more. I say, hey, look, are you willing and ready to make some changes that could radically alter your life? If he's in the right headspace, says yes, he's going to do my 4-week healthy living program. He's not only going to lose weight, which decreases force through the joint, he's going to reduce inflammation. In addition, 80% of the time, people who do my program get off their blood pressure and oral blood sugar meds in 1 month with totally normal numbers. Now, at that 4-week mark, he's reduced inflammation, reduced his disease burden, gotten off some medications, and now we can put some of his own growth factors into the knee with an expectation we can get 2 to 5 years of really good response. And it's like a win-win-win. It's all about BOGOs, baby, right? Buy one, get one free. My kind of shopping. So a lot of fun.
I can't imagine anybody comes through your doors expecting to see their blood pressure come under control or their blood sugar come under control. I'm sure that they're there focused on those acute injuries. And as you said, that BOGO, that is a heck of a bonus for your patients.
Yeah, it's so much fun. And now, primary care is in the community. They're like, hey, I'm going to send you so-and-so so you can try to work some magic on their blood pressure and help their knee or their back or their hip. And that's the best medicine, right? For sure.
Absolutely. Let me ask you this about eating a plant-based diet. Particularly, I'm thinking about my wife in this case, who recently had surgery to repair a few tendon tears in her ankle. And one of the things that the surgeon said to her was, she was a former skater. She skated competitively for years, and the surgeon was like, that tissue there, your tendons were really thin. You may want to look at increasing your protein and your collagen. In terms of like getting plant-based collagens and strengthening the tendons and things like that, is there, any wisdom to the fact that you can eat your way to stronger tendons as well? We've been talking about bone density and overall joint health, but can a person really improve their tendon strength as well through diet?
So one of the challenges are a couple of things. Number one is tendons can get injured over time through misuse, overuse, or excessive volume with inadequate recovery. So those tendons can get injured just straight up there. Number two, tendons can have decreased some of their elasticity and thickness secondary to decreased demand, right? So remember, when you begin to do those delt flies, let's say up in here, and those external rotator exercises, right, kind of working on the shoulder, et cetera, you actually create a load on the tendon, which prompts a physiologic response where the tendon says, I need to thicken and strengthen to take on this demand. And the goal of strength training is to bring the demand just high enough that it prompts that response, but not so high that it causes injury. And so we go too far, too fast. We violate the twos, too far, too fast, too soon, right? Now we can get an injury. But if we bring the physiologic load, it's called the Delorme principle is the technical term. If we go just above, right, kind of our resting level, and now up comes the tendon, it strengthens. But if we're not putting tension across that tendon in a physiologically safe and healthy way regularly, the body begins to say, well, why am I maintaining this highway if nobody's using it? And so as a result, things begin to thin out, muscle mass begins to decrease, tendons become less robust. So just consuming more protein or just taking collagen, there is zero data to support that that's going to keep our tendons and ligaments stronger and healthier. There is no data for this. But however, consuming a micronutrient diverse, calorie adequate, protein adequate diet, and then exercising at a healthy physiologic level, these various muscle and tendon groups, is more likely to then cause the body to remodel and form healthy tendons, muscles, etc. Now, in the case of your wife, it's certainly possible that her previous injuries, right, are what led to some of this thinning. But we have this desire in the anti-aging world right now, especially, that we want to have the perfect skin that we had when we were 20 and things of this kind. The problem is we're all going to die, and senescence is part of that process, right? There is a senile aspect that occurs in the body. We want to slow that process. We want to decrease the rate of decline for sure. But what's crucial that we remember that the tendons themselves and the muscles themselves, we will lose some of that lean muscle mass, some of that tendon sort of thickening, et cetera. But one of the greatest predictors of that speed of loss, et cetera, is going to be the physical fitness, the exercise of those areas that we're doing on a regular basis. And when we put the demand on, so long as we give the adequate micronutrient intake, the body will take care of itself. Just consuming more collagen, let me just go back real quick because I think this explains it. We have a genetically primed time at which our collagen begins to wear out. Right? So some people, they get wrinkles when they're 20. Other people get their wrinkles when they're 65. Part of that is genetics. Part of that is environmental, right? So if you're smoking, if you're partying till 3 a.m., if you're doing, meth, bad things happen. But if some people genetically, their collagen wears out sooner than others. And so there's a whole genetic and environmental interplay here. We want to maximize the best we can do with these areas. But just consuming more collagen doesn't mean that your cells, if they're genetically primed to begin to lose elasticity earlier, it doesn't mean they suddenly will not lose that, right? So we want to just keep that in mind.
All right, man. Great answer. And let's end with this. Let's end with some actionable items, some tangible things that everybody should keep in mind to help reduce that injury and accelerate recovery. A lot of the stuff we've talked about today, but let's end with 3 more that people can really take to the bank today.
All right, let's do it. So let's say number 1, don't violate the twos. Don't go too far, too fast, too soon. Get going when it comes to your exercise, but don't violate those. Go slowly, increase by 10% per week or so, and keep on going. That's an exercise piece. Number 2 is remember, food is information, and you want to dilate your blood vessels So add more reds, blues, purples, and greens, and I'm not talking Skittles, to your plate every day. And number 3, let's think about this. Keep having fun. We'll leave it at that.
I like that. I like keep having fun, man. It's been fun talking to you for the past half hour, Doc. This has been a real treat. And you know what? As you're giving your answers today, I couldn't help but to think you would be perfect for our big live Q&As on Wednesdays, where we do nothing but open up the doctor's mailbag and take questions from the roomies. Yeah, let's do it, man.
Whenever you're ready, let's rumble.
Perfect, man. In the meantime, check out essersports.com and esserhealth.com for more information. People can learn about your retreats there and your seminars, correct?
Absolutely.
All right, Dr. Stephan Esser, man, this has been great. Thank you so much.
My pleasure. Thank you.